So, good evening, ladies and gentlemen. Um, this is going to be a very informal New Year greeting. And first of all, I want to wish everybody a very, very happy 2021. And I'm sure that everybody would have had bad memories about 2020. And I'm sure that 2021 is going to be far, far, far better than 2020 as such. Yeah. So with those wishes, Dr. Harsha, who is my fellow, he wanted me to, I don't know why he called me a legend. I'm not a legend at all. And he just wanted me to share my experiences of how, I came up. I don't know whether I've come up, but whatever I am today, and how I started, so that the juniors might be very interested in knowing how the journey would be for them. So let us make it very informal. Now, this is going to be a webinar, and it's not going to be a talk. It's going to be just a discussion. So what you can do is just unmute yourself, and Harsha is here. He'll unmute you, and you can ask questions about, any specific point you want to know. Because I don't have any specific agenda. He just said yesterday that I'm going to conduct it and I want to do it on 1st of January. I said, okay, let's do it. So let's see what people ask, and according to that, I think I will, carry it forward. Okay, so how did I start my career? I started a very humble career, and I did my schooling in Trichy. Basically, I did my college in Madras Medical College. Really proud to say that I am a MMCite, and I did my MBBS. Those times we didn't have straight MS. We had to go through DLO, and then we had to go through MS. So what happened was, my friend, actually I was interested in orthopedics. So first time I put orthopedics as my first choice, and I didn't get it. So the first year I didn't get my orthopedics, and then I joined my senior fellow, I call it senior residency program in orthopedics. I remember this episode very well. I just want to share this because many people would be benefited by this. See, there was one incident during my housemanship where what happened was, my Professor Farooq, his name was Farooq, and he was actually, I used to be very sincere, sort of, like a real bookworm studying. And one thing about me is that during my younger days itself, I was trying to, put my best in it. So not to brag, this is not something like I'm going to brag or something. I'm just going to give some tips so that the youngsters will be benefited by it. That's it. So what happened was, Dr. Farooq, he used to take classes in orthopedics. And then what happened was, there were so many assistant professors, and then assistants, and then associate professors and all that. And what happened was, there was a case of a road traffic accident, and a girl came with a tendon injury, multiple tendon injury. So completely tendons cut. This was way back in 1990s, early 1990s, so what happened was, what I do is, whenever there's a case which comes to the ward, I read about it, and I try to prepare myself for the operation the next day. This is something which I've been doing right from my, at least from my houseship period. I've been doing that. So I saw several videos on that. That time there was not many videos like what you're seeing right now. So I saw it again and again and again. Somehow I got a clipping of tendon repair, and I saw it. Then what happened was, Farooq came inside the ward, and then he said, I'm going to give this to one of my assistant professors and assistants. And for that, he said, who knows how to do this? So this is a very important incident which happened in my life. I remember this. I think if Dr. Farooq is watching, he will definitely remember this as well. So maybe 1991 or something like that. Yeah. So I'm just junior most in the department. Junior most, just around 22 years of age. Nobody raised their hands. No assistant professor, no associate professor raised their hands. I said, can I do it, sir? Imagine a very advanced sort of, multiple tendon injuries. I raised my hand. I said, can I do it, sir? For which, Dr. Farooq was very surprised. He said, hey, what, man? This guy is not even joined 1 month before, and he says he will do it. Then he asked his assistant professor, can you do it? He said, no, I'm not ready to, and things like that. And the plastic surgeon was not available at that moment. He was, I think, held up in some other case. So I said, sir, give me a try. Why not you give me a try? You stand behind me. And then I did the case, and believe me, he said, outstanding, outstanding. He just said outstanding. That's it. Then what happened was, I read about the post-operative follow-up of this tendon injury. And I found that you should do, now everything is open. Those days, nothing was open. So I found that we have to mobilize it very early. So I went to a few plastic surgeons. I asked them, sir, when do I mobilize? They said you have to mobilize it after 7 days. Don't mobilize it early. But I had read that very clearly. I went again and again, read it. And then what happened was the next day, I didn't know, there was nothing to mobilize the fingers. Next day, what I did was I thought about it. I even now very clearly remember there was a coat hanger lying in my house. There's a hook, and then I cut the coat hanger, and then I put a POP here, and then I put the coat hanger hook like this, and I put 4 rubber bands in the fingers. And then next day morning, that happened that night at around 2 o'clock. And this is, I'm telling you, at the level of the just house officer range. When I came inside, when the whole group, 15 people coming inside, orthopedicians, and believe me, when Farooq turned towards that patient, the patient was moving her hands like that. And Farooq, Dr. Farooq, Professor Farooq was stunned. He said, hey guy, I don't know what you're going to become. You're going to become orthopedician, you're going to become whatever, but whatever field you're going to become, believe me, you mark my words, you will hit it. That's it. Because this kind of small guy doing such a job, I have never seen. So why I'm telling this, because I always say, all my students, if you have a seed, okay, a teacher is one who can identify that seed and say how far the seed will grow. This is a very important thing, my dear friends. This is something which I always say, you cannot suddenly become big. Like after 45, if you want to push yourself and I want to become big, it never happens that way. In fact, I read about this also. I read about so many legends. One thing about Pete Sampras. Pete Sampras was a Olympic player, 7 times Olympic winner. And at the age of 7, he was, adjudged to be a legend. So same way, Sachin Tendulkar, when he batted at the age of around, I think 10 or 11, they said that this guy is going to become somebody. So I think a teacher, a good teacher is one who can identify his student at the earliest possible. So always when you do, I always observe my students. I always see which guy has got that fire, which guy has got that slightly different attitude to change and to think out of the box. And that guy will automatically come to the world. You don't have to push him. So I just keep observing this. This is my first incident. My second incident I want to tell you is I was doing my DLO. And there was a case of CSOM with complications. And CSOM with complications, the patient had a temporal lobe abscess. And my professor said, okay, fine, guys, this guy might develop an epilepsy. Just write the charts and go off. But I was actually so many PGs. I was just a first year DLO PG. And what happened was I was very curious to see how a temporal lobe epilepsy will look like. So it was a general hospital, Madras Medical College. And what I did was I vacated the next bed. I requested the patient to lie down on the floor, and I lied down in the next bed. And I didn't put any sort of, I wanted to see it. At 3 o'clock in the morning, the patient developed a temporal lobe epilepsy. And I was awake and I saw that temporal lobe epilepsy live. And this is next day when the whole people came for rounds. My professor asked me, not me. Asked everybody, okay, tell me something about temporal lobe epilepsy. And I just blasted it. Being a first year DLO, the MSPG, the assistant professors, nobody could actually tell. So I always say that a person who can spend a lot of time with the patient, because the patients are the temple of learning. People forget that the books are they think the books are the temple of learning. No, it's not the books, it's the patient. It's the pre-op, it's the per-op and the post-op, which you actually see as a whole. It's a package, and that will actually lead you far away from just reading textbooks. So this is my second incident, my dear friend. So if you really want to show a difference, you have to do something different. Same way, I remember in my first year of, I worked as a duty doctor and in city hospital for rupees 700 rupees. This is my salary per month, rupees 700. I don't know if other people around the world are watching. I don't know what it is in dollars, means $10. I work for $10. Yeah, 10, not even $10, $9 a month was my salary. And I worked. And then what happened was, whenever the chief used to come for rounds, people used to ask, what is the intake, output, all that. So I thought, why is he going on asking? So what happened was, I actually pasted one big chart in the wall of every patient, and I just wrote intake, output, trials tube, everything there, and it was hanging in all the IV stands. He came suddenly, had a jerk reaction. He said, hey, who did this? And then I said, hi sir, I am a youngest guy here, but I thought I'll make it simple so that. So I'm telling you something very important, my dear friends. This is very important for life as well. The person who thinks next, that is what your chief will think or what will happen next, is going to shine. So this is very, very important. Many people forget it. They live actually in the present, but never plan for the future. This is maybe the immediate future, but I'm telling you, if you plan everything, like for example, if your chief comes, what is the next thing he will ask? And what have I got to answer? If he asks this, what should I give the reply? And if he is doing this, say it's the same with everything. For example, I tell even my students very, very, very colloquially, I tell them, if you go to the bathroom, then you should switch on the tap before you sit, because you should know whether the water is coming or not. This amount of pre-thought you should have. And this is, I think, sometimes lacking in many. They just go, sit there, and then finally, oh my God, where is the tap? Water is not coming. This is something which I think everybody should start developing. Some people don't have that, but then you have to, knowingly try to practice this as a. So that is why I always say, whenever I do a surgery, I can create a jerk reaction. The reason why I create a jerk reaction is because I can think, because I've been trained that way. I'm already trained. So that's what is called the fourth dimension of a person. You always think 5-10 steps ahead, 5-10 steps ahead. And then when the step comes, you're not actually worried at all. So everything has to be, so that is basically, of course, life cannot be planned. It's actually, it'll take a lot of curves. But in that small curve, you can plan the next, at least in surgery, you have to do that. And if you do that, I think, my dear friends, it's so easy. And people say that you, and this is again, so many people have told me, why ENT, why ENT? I always say that even today, there was a doctor who got operated by me. He was a very, very interesting case. I operated, and he said, there's somebody who told him in some other state, why do you want to go for such a small problem? He had a skull-based tumor. For such a small problem to so far, that is to me, I don't know. Why do you go? So I always say, there is nothing like a small case. There is no small case. There is only a small surgeon or a big surgeon. So there is no small JNA, large JNA. It's nothing like that. There is only a small surgeon who cannot do, or a big surgeon who can do it. And a very good surgeon who can plan it, and a super surgeon who knows when to stop. So this is what I wanted to tell you. This is life in short for me. And if you do this planning, execution, plan next, don't live for the present. Of course, you have to enjoy your present, but then you have to plan and target the future. And if you target it, I don't see any reason why you can't come up. And believe me, people say ENT, how you cannot earn and things like that. Believe me, I will always tell that never have money as your priority. If you have that as your priority, I don't think it'll take you anywhere. So have quality as your priority. That is the best quality, and automatically everything else will come. Everything else will just a byproduct. And there is nothing like ENT is bad or cardiothoracic is bad or pediatrics is bad. Dermatology. Some people say dermatology is number one. There's nothing like that. For a patient, ear pain is the highest for him because he has to get rid of it. So there is no number one field. There is no number two field. Every field is important. If you have your own touch, the golden touch, the Midas touch, I'm sure you can win and you can make the whole world turn. So it all depends upon what quality you're going to give and not what quantity you're going to give. And many people mistake, at least in India, we see this very often, the number game. I have done 10,000, 2,000, 5,000, 6,000, 1 lakh, 20 lakhs. This is all to me bullshit. This is nothing. I did a pre-lacrimal approach a couple of days back, and not even, a couple of months back. I just did a small deviation from the technique. And then, in fact, sometimes I don't even publish, but then my residents know every step will be slightly different from what it has been written in the book or given in a paper. So this is, I think, the most important thing, to think out of the box. And if you think out of the box, be creative. For example, that day, I think you saw the pituitary. Usually, I also say don't cauterize. But that day, I cauterized because there was the sea of, blood. The intercavernous sinus was filled with blood. And that is where you think next, and then you go ahead. So this is basically life. And I'm sure that these words are enough for you to become big. I don't know whether I'm big. I'm not that big. I don't care because I do not want to become big also. I think the most important thing is to get a good teacher. I think many people, they feel that they have good teachers. I'm honest. I'm very honest. Sometimes I might be bad also in some of the statements. I'm sorry. I don't want to mean anything bad. Do not think that your teacher is the best. Number one. Always look for the best teachers in the world. This is something which I always believed also. So some people say that, I have by college, I have a teacher and that teacher has taught me this and I think I can settle down and do this. I think that's what I didn't do. That's very important because you have to travel around the world. For example, when I did my MBBS, ENT, MS ENT, I was one of the first postgraduates to do endoscopic sinus surgery. But by the time I was practicing, while doing MS, I was practicing also. So that gave me a beautiful combination, deadly combination of studies with practical application. I could do a thyroid during my MS. I've done the maximum stapedectomies, at least as a postgraduate in MMC. I can say that boldly. Professor Gananathan helped me. As a teacher, he helped me in doing a lot of cases. Same way, the most important thing, my dear friend, is that, see, I want to tell you something very interesting. You know that I'm now having a hobby like singing. I sing a lot of songs. See, let me tell you how I think about this. Okay, now in singing, there was a singer who sang some song, and then I wanted to just understand the person's mind. So I just asked that singer, boss, what do you think about your song? Then the person said, yes, I've sung very well. Then I said, you think so? He said, yes, of course. I'm very sure that I've sung very well. Then I said, how much marks is just, he's my very close friend. So I just asked him, how much marks will you put for yourself out of 10? Out of 10, if you have a score, how much score will you give for your song? He said, I'll give 7 out of 10, maybe 3 because of mistakes. Then he asked me, how much marks will you give for my song? That is his song. I said, boss, you know what? I'm not interested in giving you marks. Let's end this conversation, because I just want to know your mind, your state of mind, how well you judge yourself. So this happens also in surgery, my dear friends. See, one thing about song, I'll tell you about singing, is that you have a standard. That means you have something to compare. For example, Kishore Kumar, or for example, S.P. Balasubramaniam, or whoever it is, has sung one song. And at least you can get a good copy of that song. You can actually, that's a standard protocol there. And at least you can get that tune, you can get that to actually equal yourself like the original singer. So maybe that will give you some additional marks. Okay, fine. Just a scenario, okay? Now, the thing is that, see, when you actually copy that song, I'm going to compare now with surgery, okay? In surgery, you don't have any standard. You don't have a person who has given you, this is the best surgery, and this is the way you have to perform. Even that, for example, let me sing this one. He has given something like that, and he has got 3 or 4 bends in that. So you know there are 4 bends. But if you break a song, you break just one particular phrase, you have 4 different bends. Okay. Now, do we have that in surgery? You don't have that. You don't have any standardization in surgery. Anybody can do a surgery in any possible way. This is more difficult. It's more difficult than having a standard logbook. You have a log 10 out of which you can perform. But in surgery, you don't have that. Now, listen to me. Now, there are 3 kinds of different levels. Level 1 is to master the art of surgery. Okay, now I'm going to master the art of surgery. How do I master? Now I'm going to see the surgeon, the same way here, the singer, and let me again sing. And by practice, of course, you will be able to do it. So that is stage 1. Stage 1 is start practicing. That is doing cadavers or temporal bones or whatever. You are in stage 1. Number 2 is that you are going to copy that guy. So, for example, somebody wants to say that I'm going to copy you or whatever. So he's going to copy me, and he's going to be absolutely superb, and he's going to absolutely replicate whatever, and that's going to be stage 2. But please understand, my dear friends, in stage 1 and stage 2, maybe you will be noticed in your state, you might be noticed in your country, but you will never be noticed in the world. Please understand, SPB is SPB, or Ilayaraja is Ilayaraja, or R.D. Burman is R.D. Burman because of his creativity. This is the basics of becoming big. If you can't create, if you can't think original, then you cannot become big. So that means what I want to tell you, my dear friends, is that stage 2, that is the level of copying. If you do perfectly, I do a staphyrectomy like Shia. Shia is the inventor, and you have done a best staphyrectomy like Shia. Please understand, we don't want another Shia. Who wants another Shia? Who wants another Lampert? Who wants another Rosen? We have to be ourselves. For example, if you want to become big in ENT, for example, Professor Sethi has got his own name. Why? Because he did the first pituitary surgery out of the box. He thought about it, he did it out of the box. And that's why he's got a name, not because Professor Sethi does a face like Professor Stamberger. He can do a face better than Professor Stamberger. I'm not comparing anybody. Let me not hurt anybody's feelings. Stamberger is a don. Okay, forget that. What I mean to say is just an example. Okay, he has done something original. Same way, Professor Castellova has done something original. Professor Aldo Stam has done something original. So this is what the world wants, my dear friends. Professor P.J. Ormold has done something original. I'm just talking about rhinology. I don't know so many people like Graham Clark about cochlear implants. Same way, Bill House, Mario Sana. All these people, if you notice them, how did they hit the world level? It is because they have been original. So please, my dear friends, don't be in a well. Don't say that you are perfect in whatever you do. It's all priorities again. If you want to be this way, then this is the path. I'm just telling you. Yeah, okay, I'm happy earning my money and that's it. Okay, fine. It's up to you. So this talk might not even relate to what I'm talking then to you. So if you want to become a world figure, a world-renowned figure, that means you have to think out of the box and you have to have your own creation. So I think that's it. Let's take some questions. Let me not talk too much and then you will get bored. Okay, let's Harsha.
How did you develop the surgical finish? What sorts of hands-on training have you undergone?
Yeah, you can tell the name so that I can mention the name.
Vaishnavi.
Dr. Vaishnavi has asked what question?
How did you develop the surgical finish?
Okay, see, I'll tell you what. To me, I think finesse should be there in your gene. So this is something which might be a very harsh statement, but basically I feel that finesse should be there in your gene. The reason is because what happens is that the obsession to finesse is something which you have to you develop inside you. You have to develop inside you the obsession to finesse. People feel that whatever you do is good. Never as a postgraduate. All these talks are just for postgraduates. Please understand, not for seniors who have already attained great names or above 40 or about 35. This is just for a 25 to 30-year-old, this talk. Please understand. Don't mistake me if maybe I'm giving an advice to somebody who is already got his name. That is not my intention. So, what was I talking? Yeah. So, never ever think that what you have done is the best. Okay. Now you have a standard. Try to, maybe there's a video by Professor Stamberger, Professor Sethi, or Professor Costello, whatever. You have that as a standard and try to go to stage 1 and then stage 2, how to do best. For example, if they remove the uncinate in the right way, try your best to do that. And when you are not able to do that, go back onto your video. Just put your video. I have seen my videos at least 100 times. I critically review my video. This is something which is not being done. I've seen so many postgraduates here. I just shout out my throat and say, please record, man. Please record, man. Then they say, sir, recording device only I don't have, sir. Even if you don't have an endoscope, it's okay. But you should have a recording device. This is the most important part of the progress. So unless you see your stammering, you see your failures, or you see your the steps in which you're not fine, you cannot improvise. So the secret to finesse should be to see your own recording and see where you're not able to do as good as your professor or your whatever you had your standard. And if you're not able to do that, then try to do that to perfection. That is called finesse, number 1. Number 2 is that's not enough. That's not enough. You have to go one step above. I always say, fall at the feet of your mentor. Fall at the feet of your mentor, but never God worship him. This is something which happens in India. They call, I always write a boss. You talk about the boss, or you talk about the Don, the legend. All these, I'm telling you, are doesn't have meaning to me. People say that. In fact, I saw an interview by Srimati Indira Gandhi, and she was telling me, and an interviewer asked him, people actually call you God of India. What is your opinion about it? You can see that interview on the YouTube. It's there. So that hit me very hard. And actually, you know what she answered? She said, that's India. That's India. People will just flatten you out of your box. And if you get it into your head, then you are cremated. You will go down. So never have that on your head when somebody prizes you. I never even care for a prize. I don't want a prize. I don't care. People think that I want to show off, or I want to get prizes from them. Believe me, I hardly even think about somebody prizing me. If I think prizes should never be on the face, it should be behind you. And if somebody is prizing you on your face, I think you should never take it into your head. Because if you take it into your head, then that's the starting point of your downfall. The best price is from your own conscience. This is something I want to tell all the juniors. Never, ever, ever, ever try to, think that somebody is pricing you. Oh, wow, fantastic. Everybody does that, they will tell everything to everybody. Never take it to heart. Always analyze yourself. And unless you are going to critically analyze your steps, put that. And then I always tell Shilpi, when I do a conference, hey, this step I didn't do properly, man. This step I should have done slightly better. And she says, oh my God, I thought you done it well. I am not satisfied. So the moment you say, I am not satisfied with myself, that is progress. The moment you say, I am satisfied, that is your downfall. So these are some things which I have been cultivated from my younger days. So this will not go away from me. Even in singing, when I take it, that's why I make my hobbies very serious. And for example, today when I sang some song of Amol Palekar, I was just wondering, why did he bring that two ragas like something like that? And I was analyzing that very, very keenly. I was going into it. This is obsessive character, but you don't have to be so obsessive. You can at least be serious about it. Yeah. So, any other question?
With the limited number of Dr. Shivani Agarwal, you can actually.
Yeah, Dr. Shivali, you can unmute yourself and you can ask your questions. I mean, let us be sort of interactive. Let us make it interactive. Shivali Agarwal, you can unmute yourself. Dr. Harsha is here. Yeah.
So, good evening.
Hi.
So my question is.
Yeah.
My question is, with limited of SRships and fellowship in India, we can really learn by observing videos and watching seminars, but it's really tough to get into some getting to work under, getting some fellowships. So how do you proceed after that?
No, I didn't understand your question. You said you can't get fellowships, difficult to get fellowships. What are you telling? I can't understand. What is your question? What?
There's difficulty in getting into fellowships.
Yeah, can you repeat your question, Shivali? Can you repeat your question?
I'll repeat, sir.
There are limited number of SRships and fellowships in India. It's really tough to get into one.
So
how do you start? Seeing and observing videos is one way. What else? Please understand, my dear friends. Imagine that you guys have at least videos. Okay, we were in an era where there were no videos. You should understand that. Okay, we were in an era where there are no videos, there are no mentors, nobody who will call us and teach us. So I think to learn, I think there's only one way, madam. See, for example, I used to tell my students, see, cadaver dissections. There are no cadavers available. This is something which everybody says, there are no cadavers available. So what I used to do is, I used to come during my MS period and I used to go to the FM lab in Trichy. I traveled from Madras to Trichy. Every Sunday I used to do that. And every Sunday I made it a point to dissect. Okay, I paid that money or whatever. I may not be able to reveal everything that. I think you have to innovate your own way to learn. Okay, you don't need any mentor to actually guide you for a long time or something like that. The most important thing is to do cadavers again and again. Do cadavers, and more importantly, even cadaver dissection labs. I've seen so many. They will pluck and pull the cadaver. I will always tell there is no use in doing that, boss. Because if you pull and pluck in a cadaver and you go to the surgical room and you try to use a debrider, it's a hell of a difference. You have to treat a cadaver like a human being and do it. So you need a fresh frozen cadaver. You have to practice on it. That's how I learned my temple bones. I did a fresh temple bone. I used to either dig, whatever you do, but beg, borrow, or steal to learn. Number one is that. Number two is whenever you see today, you have videos of great people. For example, you have videos of everybody. You have Professor Sethi. You have I'm talking about rhinology because I'm a rhinologist. You've got so many people, and you can compare that with your video. Just record whatever you do, and then compare it with the video. See, the main thing is when you do, so many people say, sir, I didn't get a chance at all in MS. This is all is nonsense. I've done 100 septums. I'm telling you, this is all waste of time. If you do 500 mastoids wrongly also, it will not lead you anywhere. If you do one mastoid properly, it will lead you somewhere. So how do you learn that one mastoid properly? It is by recording your own mastoid, learning from it, and then comparing it with a standard. So now you have videos, have that. More important than seeing, my dear friend, I will tell you, Dr. Shivali, there is no point in seeing a great surgeon. There is no point. You might learn something. Of course, there's a lot of point, but you can see it. But it all happens when you do. When you do, you will think, oh my God, he's doing it so well, I'm not able to get it. You will not be even able to reach the uncinate process, while that guy will be going into the frontal and playing with the frontal. So unless you do, you cannot get it. So you have to, there's no point working under somebody as an observer for 10 years. That's why I've never been an observer for more than 3 months at any given center. Because I have to see it, come back, do it, and go back again, see it, come back again, do. This is going to be the cycle, or else you cannot master the art of surgery. I hope I answered your question. Yeah, I think Dr. Nishit Shah is here. Let us unmute Nishit Shah. I don't know if it's Nishit Shah. He is my master. Huh? Oh, okay. Neha Shah. Okay. So, Dr. Shanmuga Priya. Yeah, Dr. Shanmuga Priya, can you unmute and talk, please?
Yeah, it's
Yeah.
Actually, after hearing to your story of reaching this position, like I'm awed how much you've been struck. I mean, how much you have put your efforts into your profession. And this is where I just want to tell you about because I'm a dermatologist. I was really interested in practicing clinical dermatology. Of late, I've started practicing this cosmetic dermatology. So we do give fillers. This is very simple procedures. These are very simple procedures compared to what you're doing in your day-to-day life. This is nothing actually when you compare to what you're doing. But anyway, this is what it's our this. So that is, we do fillers for the face. As fillers is like just fillers is filling like any wrinkles or lifting your face, tightening your face. People do come for it because I am in UAE and people are very much.
I've also had fillers, so you don't have to tell me. I've had fillers, I've had Botox. I was a very chronic user. Okay, carry on. Yeah.
Okay. I think as people, like, we do have a lot of complications with the fillers. It's really a safe procedure as far as it doesn't enter into any vessel. If it enters into a little bit of filler, if it enters into an artery, not vein, into an artery, it's going to cause immediate blockage of the the supply, vascular supply, and it slowly it will start the area will start necrosing. And there are reports of retinal and complete blindness also when you inject the filler into the bridge of the nose. And these things, no. First, I was like it's all see what are you doing? It's you're going to penetrate. You're seeing the actual vessels inside and going through it. Now, it's what we are doing is we're not. I mean, it's over the surface. Like, we're not going to see anything inside. So then there might be some anatomical malformations or anything. So what there was like there's one professor, Dr. Mauricio. I was it resembles the same story as his been struggle or his hard work or everything. It resembles the same as you had gone. What he was doing is he did all the cadaver dissection. He did all cadaver dissection, and he saw where the anatomy of the vessels, where everything lies, and he himself gave injections, and thus he came to a conclusion, and thus he's given written a lot of books about where to give and where not to give, how to inject, and where do we have to be very cautious, and all these things. He has done like immense thorough what to say, like homework regarding this. I mean, he has come to a conclusion. So whatever it is, achieving is not that easy. So we have to put your efforts. You have to put your efforts. There should be perseverance. There should be hard work, and everything is like a package. You have to have everything to achieve this. So this is what I was like. After he been reading to his story, how he came and how he did. I was like really been it was an inspiration, and after hearing that, and it resembles the story, I am really proud of you, because anyway we Indians are proud of Indians achieving in a global level. So it's an inspiring story.
Thank
That's
you.
all I.
Thank you, Dr. Shanmugapriya. Very, very nicely put it. I just want to add only one statement, Dr. Shanmugapriya. Is
Yes,
that wonderful? I mean, I really appreciate your statements, and you have observed that mentor who has put in a lot of efforts. But when you converse, you are just telling he has done a lot of efforts. He has done so much. He has done so much. That's very important. This is what hits me very hard. This is what hits me very hard. I always think, when it is he, why not I? I always have that burn, the fire. I always think, why not I, man? Why didn't I do it? Why didn't I find it out? Why didn't this is something which it burns me. And when I think that that's a guy who is doing it, then I always say, why not me? Why not me? I should do it. So I think that's a very nice statement, Dr. Shanmugapriya. That is the most important thing is the effort, the amount of hours you put in. There is a famous saying, 10,000 efforts, the 10,000 hours. That is my brother, Dr. Raj from Texas. He always says the 10,000 hour book. You can read that. So if you put in efforts, you will get the result. But it's not only the effort, but how much different you think. That is effort plus your touch. That your touch is why you say he has done. He has done. Even if you put wrestling, I will actually beat whatever field. Just have to think out of the box and think, why didn't I do this first? Why didn't I introduce the wrestling to the world? If the youngsters start thinking in that way, I think it's going to be different for the youngsters. Yeah. Thank you, Dr. Shanmugapriya, for joining.
Thank you, Doctor.
Thanks a lot. Yeah, we have a lot of people now. So many people joining in from all over the world. I'm so happy. So let's see. Did I choose ENT as my first choice? I told you orthopedics was my first choice. I didn't get it. A beggar cannot be a chooser. So I chose ENT. But what I really did was, for example, I studied in MMC, the hostel guy who was a pediatrician, and he passed his USMLE. He went to US. I mean, he was doing his MD pediatrics. I was doing my DLO then. He used to say, hey guy, you are just ENT. You're just ENT. And what are you reading ENT for, man? You'll read last 1 week and write the exam and you'll clear it. And this actually was a strong negative force for me. And I whenever he told this, almost every day he used to see me, every day he used to tell this, I thought, let me read this, man. So very important thing is never think a subject is, less or more. Today, when I met that guy in pediatrics in USA, believe me, whatever he has achieved, whatever he has earned, whatever he has, published, I think 10 times more I have done. So not to, boast myself, but what I mean to say is, see, all those days I was so depressed, but that depression gave me so much of force to study. And today, when many people from the US come, I just say, what the hell, man? What is your own original contribution? This is the first step I ask them. So, I always say that you should always have originality, and you should be in a position to have your handwriting, your signature in everything you do. And if you do that, for example, when I started scuba diving, I had my own ways of thinking how to go into a deep water. What should I do? How many respirations? So try to analyze everything to the depth. Read, analyze, and then think out of the box. This is the simple way to success. Yeah. Next question, please. Anybody else?
Dr. Devendra Tiwari
Hi, Devendra Tiwari. Where are you from? Where is he from?
UK.
Oh, from UK. Wow.
Please let us know what you
Yeah,
are.
let him unmute and let him talk. Why is he not showing his face? I mean, you can't show your face. Yeah, you can show your face, man. I mean, you can turn on the videos, and Shanmuga Priya, you can also, I mean, like, turn on the videos and you can chat with me. This is just an informal chat. And if you feel that you're bored, you can leave at any time. This is not agenda based stuff. Yeah. Yeah. So, I mean, who is now going to talk to me?
Devendra Tiwari.
Devendra Tiwari?
Yeah, hello, sir. I'm Dr. Devendra Tiwari. I'm doing my MCH in Canterbury Christ Church University in UK. I did my post-graduation from India, and I'm a very big fan of you. I watch your videos and all that and learn a lot of things. So I just have a question. What do you recommend for this young professional like us to start in the start of their career? For example, how we are going to add up new surgeries in our profile, or when we should start our private practice and all that?
Yeah, boss, I will tell you something. I have the rule of 5. I always tell this to my fellows. The rule of 5. What is the rule of 5? By 25, you should complete your post graduation. Okay, by 25, max by 27. By 33, that is from 5 years from then. By 33, you should be a master in all the surgeries which you're going to perform. By 33, and by maybe another few years. So from 33 to 38, you should be known in your country. Okay. And by 45, you should be internationally known. By 50, you should retire. So I am 50 and I should retire. Hello?
Yeah, hello.
So there is no point in going. Hello? There's a lot of crosstalk, Shah. So I'm answering Devendra Tiwari. Devendra Tiwari, see, I'll tell you, if you go abroad, the problem actually is to get hands-on, okay? So unless you have hands-on, you just keep seeing your professor, believe me, you cannot learn. So you have to stay for a short period of time and then come back.
Okay, you had your pasta?
Come back to the place where you get a lot of, work. For example, if you can't do a proper MRM, what time I take for MRM? What is happening?
I put check to have no. I
Hello?
put check on the table.
Mute everybody. How can they? Okay, so the thing is that unless you practice on your patients, the training is not complete. There is no point in saying that I have learned so much, I have learned so much. Maybe 1 year you can learn, and then
Giancarlo,
you. Okay, can you hear me now? Okay, so the most important thing is to practice on your patients, my dear friends, or else there is no use of having an observership period for tons of years. I've seen people having 10 years, 12 years of observership, and this is, I think, waste of time. Max is 2 years or 3 years. That's it. You have to come back. You have to practice. That is very important. Yeah. So anything else? I think the juniors, what they have to do is never start practicing immediately. Never try to go abroad. To me, I think wherever you're born, that is the best place for you to practice, because you know your language, you know your people, and India is a beautiful place. Believe me, India is so populous, and for a doctor, opportunities are so heavy, so heavy. If you have to shine in the world, I think India is the place. Believe me, from India you can hit anywhere. You can even hit the moon. So don't ever think that you have a disadvantage.
come here. Did
Yeah.
you eat the cake? Huh? Who ate the cake then?
Who is that guy? Okay, so I think we'll go to the next question.
Giancarlo ate the cake alone? Giancarlo?
Who's that guy who's yelling actually? Okay.
Giancarlo.
It's not showing here. Who is that? Everyone is muted.
Everybody's muted. Maybe Cisco WebEx has got a new guy who's. Okay, right. Any other questions, or we will call it a day? So, wish you a very, very happy New Year, my dear friends. I'm very delighted to inaugurate this Meet the Legends program by Harsha, Sahasra Foundation. And he's a very good fellow. He's learning a lot. I'm sure that he will, create ripples and laurels to himself and to the country. And so,
Yes, Giancarlo ate it. Yeah. It was for you to have it. You just got it and have